The following presentation includes a discussion of hypertension and a demonstration of proper home blood pressure monitoring according to the 2017 American Heart Association's Clinical Practice Guidelines for the Prevention, Detection, Evaluation, and Management of High Blood Pressure in Adults. Certain things put you at a higher risk for high blood pressure. These include smoking, diabetes, high cholesterol or hyperlipidemia, being overweight or obese, physical inactivity or a lack of exercise, and an unhealthy diet. Illicit drugs, alcohol, caffeine, decongestants, NSAIDs such as Advil or Motrin, amphetamines, steroids, and birth control may all increase your blood pressure as well. Hypertension is defined as an abnormally high blood pressure. The American Heart Association has categorized blood pressure as normal, elevated, stage 1 hypertension, stage 2 hypertension, and hypertensive crisis. You should always notify your healthcare provider immediately if experiencing a blood pressure greater than 180/120. Uncontrolled hypertension can lead to stroke, vision loss, heart failure, heart attack, kidney disease, and sexual dysfunction. The diagnosis of hypertension requires integration of home or ambulatory blood pressure monitoring in addition to blood pressure measurements taken in the clinical setting. Research has found that home blood pressure readings correlate more closely with the results of real daytime ambulatory measurements than with the blood pressure measurements typically obtained in the clinician's office. Proper technique is required for accurate measurements that are necessary for the proper diagnosis and management of hypertension. Proper home blood pressure devices include those that are automatic with an upper arm cuff. Wrist and finger monitors are not recommended because they yield less reliable readings. You should choose a monitor that has been validated for home blood pressure use. If you are unsure, ask your healthcare provider for advice. It is also important to try to obtain a device that can store your readings. Most devices are cost efficient, ranging from $20 to $50. Ideally, you should always bring your device to each appointment, but at least once a year. Prior to measuring your blood pressure, you should have an empty bladder and sit with your back supported and feet flat on the floor. Do not cross your legs. The blood pressure cuff should be placed on your bare arm with the top and bottom of the cuff fitting similarly snug on the arm. The arm should be rested on a flat surface at the level of the heart with the palm facing upwards. Sit quietly for 5 minutes before taking your blood pressure. You should take your blood pressure twice a day, in the morning before taking your blood pressure medication and in the evening before bed. Document your blood pressures on a log and bring to each of your appointments. The American Heart Association defines hypertension as a blood pressure greater than 130/80. Hypertension is associated with an increase in the risk of cardiovascular disease. Home blood pressure monitoring can be used to assess out-of-the-office blood pressure in order to detect white coat syndrome and masked hypertension. Your blood pressure may vary, high or low, within the measurement period. Always notify your healthcare provider if experiencing a blood pressure greater than 180/120 or an elevated blood pressure that is associated with a headache, dizziness, blurred vision, chest pain, shortness of breath, or palpitations.